In today's video, I'll be discussing renal failure, its causes, types, complications, preventions, and management. The kidneys are responsible for filtering waste products and excess fluid from the blood, as well as regulating electrolyte balance and blood pressure. Renal failure, also known as kidney failure, and I'll be interchanging the term renal failure as well as kidney injury throughout the video, is a condition in which the kidneys are unable to function properly, resulting in a buildup of waste product within the body, and fluid can also build up in the body, leading to serious health problems. The diagnosis of renal failure can be made by monitoring blood tests and urine output. Increase in the blood test known as creatinine indicates that the kidneys are starting to fail. Monitoring other kidney function blood tests, such as an increase in your blood urine nitrogen, also known as BUN, and a decrease in the kidney's glomerular filtration rate, also known as GFR, can also indicate damage to the kidneys. There are two main types of renal failure, acute and chronic. Acute renal failure is a sudden loss of kidney function that occurs over a period of hours to days, and chronic renal failure is a gradual loss of kidney function that occurs over a period of months to years. Acute renal failure can be divided into three subgroups: pre-renal, intrinsic, and post-renal failure. Pre-renal failure is the most common form of acute kidney injury, and as the name implies, it typically occurs due to processes before the kidneys that eventually result in damage to the kidneys. It results from decreased blood flow to the kidneys, such as hypotension or low blood pressure, as well as hypovolemia or low blood volume, or renal vasoconstriction or stenosis, which is narrowing of the renal arteries. With pre-renal failure, there is typically rapid improvement in renal function following acute interventions, such as with IV fluids for hypovolemia or blood pressure stabilization for hypotension. Causes for intrinsic renal failure include any conditions that leads to severe direct kidney damage, and it's responsible for about 35% of cases of acute kidney injury. Examples of this includes any processes that leads to inflammation of the kidneys, such as glomerulonephritis, as well as certain infections that can directly damage the kidney, as well as certain medications that are hard on the kidneys, and also some blood vessel inflammatory diseases such as vasculitis. But the most common cause of intrinsic renal failure is a process known as acute tubular necrosis. Acute tubular necrosis is responsible for approximately 85% of intrinsic acute kidney injury. So let's break the name down. Acute, meaning it occurs rapidly over a matter of hours to days. Tubular, meaning it affects the renal tubules. Necrosis, which means an irreversible damage or death. Therefore, acute tubular necrosis is the rapid, irreversible damage of the renal tubules. This can be caused by drugs and toxins that are harmful to the kidneys. It can also be caused by a prolonged decrease in blood flow to the kidneys, resulting in death to the kidneys tubules. Post-renal acute kidney injury is due to processes after the kidney that results in damage to the kidneys itself. So again, as the name implies, post meaning after, and then renal meaning kidney. So any injury that occurs after the kidneys that eventually lead to damage to the kidneys. Causes include any condition that results in bilateral obstruction of the urinary flow from the renal pelvis to the urethra. Some examples of causes of postrenal failure include benign prostatic hyperplasia or BPH, tumors, stones, or clots that obstruct the urinary outflow. Acute kidney injury is typically defined as the presence of any of the following criteria: increase in serum creatinine by greater than 0.3 milligrams per deciliters within 48 hours. Increase in serum creatinine to greater than or equal to 1.5 times the baseline level within a 7-day span. A decrease in urinary output to less than 0.5 milliliters per kilograms per hour for greater than 6 hours. Some of the symptoms of acute renal failure include decreased urine output, swelling in the legs and feet, nausea and vomiting, and confusion. Diagnosis of acute renal failure involves blood and urine tests, imaging tests, and a physical exam, and treatment may involve IV fluids, as well as medication adjustments and dialysis. In regard to chronic renal failure, as previously mentioned, it occurs over a period of months to years. Causes include diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. Symptoms of chronic renal failure may only come on gradually or not appear at all until the condition is advanced. Complications of chronic renal failure can affect almost every system in the body, such as anemia. This can cause fatigue, shortness of breath, and dizziness. Chronic renal failure can also affect the musculoskeletal system, resulting in bone disease due to a lack of calcium and phosphorus regulation in the body. This can lead to bone pain, fractures, and deformities. It can also affect the cardiovascular system, resulting in high blood pressure, fluid overload, and electrolyte imbalances. Cardiovascular disease is also the leading cause of death in renal failure patients. Infections are also common in individuals with chronic renal failure due to a weakened immune system. Urinary tract infections, pneumonia, and skin infections are all very common. In regards to prevention and management, maintaining a healthy lifestyle by eating a healthy diet, exercising, and avoiding toxins such as smoking and excess alcohol consumption can help in prevention of chronic renal failure. This also helps to prevent diseases such as diabetes and hypertension that could eventually lead to renal failure. Adequate fluid hydration to prevent adding stress to the kidney's filtration abilities and also preventing pre-renal acute kidney failure is also important. Managing chronic systemic diseases such as hypertension and diabetes by maintaining regular checkups with your healthcare provider to ensure disease is not rapidly progressing. And lastly, if the disease continues to progress, then treatment measures include medications, dietary changes, and dialysis or kidney transplant may be necessary. So in summary, renal failure, also known as kidney failure or kidney injury, is a condition in which the kidneys are unable to function properly, resulting in a buildup of waste products within the body. The diagnosis of renal failure can be made by monitoring some blood tests such as creatinine as well as urine output. There are two types of renal failure, acute and chronic. Acute renal failure or acute kidney injury is a sudden loss of kidney function that occurs over a period of hours to days, and there are three main subgroups: pre-renal, intrinsic, and post-renal. Chronic renal failure, on the other hand, is a gradual loss of kidney function that occurs over a period of months to years. Complications of renal failure can affect almost every system in the body, but the cardiovascular disease is the leading cause of death in renal failure patients. Management includes maintaining a healthy lifestyle, adequate hydration, adequately managing chronic systemic diseases such as diabetes and hypertension. Regular checkups with your healthcare provider to ensure disease isn't rapidly progressing is also important.